activity, empowering students with skills in and out of the classroom. Swimming is a life skill that is cardinal for survival. Our ballet programs teaches more than just dance. It installs grace, discipline, and expression. The heart of knowledge builds in our school library with a wide collection of fiction, non-fiction, reference material, and digital resources. Our school offers exciting and safe playground facilities for both ECE and primary students. Safety is our top priority, and our drivers are carefully selected for their professionalism and commitment to the well-being of our students. At Christ Life School, we believe education is not just about passing exams. It's about preparation. So, if you are looking for a school that feels like home, where your child will be known, loved, and challenged to reach their highest potential, then Christ Life School is the place.
Welcome to Community Health. My name is Jacqueline Mankanda, and I'm excited to be here today with a very special guest all the way from Amarillo, Texas. Our discussion will be based on health, faith, and giving back to the community. Welcome to the program.
Thank you so much.
I have with me, as I was saying, Dr. Trey Bowen. I hope I got that right. Thank you for coming and spending time. So my question to you would be, why did you choose to be a doctor?
Well, it wasn't something I knew that I wanted to do all along. I was a senior in high school and trying to decide what field in university or college to pursue, and couldn't really decide. But I knew I wanted to do something that allowed me to pursue missions and some form of a missionary, and so someone suggested maybe considering medicine. And so we had a family friend who was in emergency medicine, worked in the emergency room, and he graciously allowed me to shadow him and to take notes for him, and I just fell in love with it. I loved the combination of science and critically thinking through problems and how to solve them, but also the relational aspect. So how to develop connections with people and to provide care and support to them.
Wow. And we do know that medicine tends to pair very well with faith, as you've hinted around missions. It's a common combination. So you didn't have perhaps a family member who you were looking up to, so it was just you, or do you have doctors in your family?
Right. I have a sister-in-law who's just a few years older than me, and she was pursuing medicine, but aside from that, we had no other doctors in our family. And so this was kind of a new trail to blaze. So I learned a lot through the process. But I had a family that really supported me throughout that process and encouraged me to pursue opportunities in medicine.
Okay. So what is your specialization? Are you dealing with younger patients, older patients? Particular needs, perhaps? What's your line of work?
So I'm specialized in internal medicine and specifically primary care. So I take care of only adults, but anything from 18 onwards, but focused on primary care. So that would be if you were to need to go to the doctor for a cold or cough or high blood pressure, that would be the first person you would see. I do like the breadth of primary care because I get to take care of a lot of different things, and also get to be the first person to help navigate what sort of disease this person could be having. So they come with symptoms, and I can be the first person to help walk them through that. Sometimes patients need more subspecialty care, like a heart doctor, cardiologist, an orthopedic doctor, a surgeon for broken bones. But I like to kind of help be help coordinate some of that care with the patients.
Kind of like a conduit.
Yes, exactly.
Okay, so you're a connecting point from the patient and whatever needs they need to take care of. Okay, interesting. So looking at how long it takes for you to qualify, it's an investment of heart and love and quite a number of years. How did you navigate that journey in your personal life?
Yeah, I remember thinking as a child that I didn't want to be a doctor because it was so daunting how many years had to be in school and in training afterwards. And still, when I think back on it, it's a long time. But a pastor at our church that we grew up had preached a sermon that I really resonated with, and he talked about when the Israelites were taken into captivity and how at first all they thought about was when they were going to be returned. But God had told them, no, seek the prosperity of the city where you're living in. Build houses, be where you're at. So I had that thought during medical school and training, was that God had something for us to do during medical school or during residency, and not to just think, oh, how much longer till I can be an independent doctor, right? But just to love the people I'm in contact with as a student, the patients I get to see as a student, my classmates. And I think that helped me. I didn't feel like my life was on pause, but that so much life happened while I was in school.
And did you have fellowship whilst you were in training at college? Were you able to find like a church to go to or a study group? Was that available to you at the time?
In medical school, it was such a blessing. We had a few organizations, and one was called Southwestern Christian Fellowship, which was that was the name of the medical school I went to, UT Southwestern. And it was just a group of fellow believers that met to talk about how faith and medicine integrate. And there were a lot of really excellent mentors that just loved the Lord, and they would come and speak with us, and we'd meet and have worship times together. And so that fellowship was just such a blessing, and they really included spouses. So my wife and I were married while I was in medical school, and so to have her be such a part of that fellowship as well was a blessing. And we were part of a church there as well, and helped to be plugged into. Also, my whole life wasn't consumed by medical school, so we also had brothers and sisters in Christ who weren't in the medical field. Sometimes it was helpful to get away from that and just seek the Lord with people that were in different careers.
Wow, that's really interesting to hear. And then I would like to find out, what does missions mean to you? Because obviously it can be taxing to move away from home for a period of time, leave what you're familiar with. Can you describe how you felt the first year that you came to Zambia? Sure.
Yeah, so last year when I first came, I was used to practicing medicine in a certain way, and have certain tools around us. I do work at a clinic that provides free care for patients without insurance back in America. But this was so different because the volumes of patients were much higher, and the tools and resources available to us was lower. So back in Texas, I could order labs right there on the spot. Sometimes I could get results back right on the spot. If they needed a heart doctor, it was easy to connect them with the heart doctor, and we had several medicines available to us. And through different programs, we could apply for them. So here at first was so daunting because if I saw a patient that I felt needed a certain number of labs and certain medicines, but we didn't have either available, it was hard to feel like, okay, how can I best help? And just seeing the numbers, I didn't felt like I wasn't able to take the time that I wanted to with each patient. But I think comparing last year to this year, knowing some of those limited resources coming in, I was able to think more about, okay, well, here's how we can use these medicines, or I can use my physical exam to better figure out what's going on and how to support the patient right now. And then to think about long term, what's more important. So maybe when someone had high blood pressure here, last year I would have prescribed a medicine. This year I can still prescribe the medicine, but it's medicines that are here in Zambia that they can continue. And then talking about how does diet and exercise play a role in the blood pressure too, and thinking about some more long-term solutions. It's still a challenge, I think, coming in for a short period of time and then leaving. Not how primary care is designed to be. So still constantly learning about how to best best try to help.
Yeah.
But I think it's helpful to take what I learned last year and apply it to this year.
Yeah. And it's a good thing that you are able to see the world from both sides, you know, what you have access to back home and the gaps that you see here. So my question to you would be, if you were to encourage a medical practitioner, a local medical practitioner, knowing what you know about what we may not have, what would you say? How can they keep going, you know, keep delivering the best service regardless of whatever they may feel is missing?
That's great. That's a great question. I think there's some things that you know you can help with, and then other areas that you know you need some further support.
Yeah.
So I would say to really focus on the things you know you can help with in the immediate setting. So that would, when I think about primary care, I think about good control of blood pressure, good control of your blood sugars, making sure you're exercising, having good access to foods. And so some of those things that I think a primary care doctor here could be able to do long term every day. And I would say that focus on those topics can really help people down the line. If you're controlling their blood pressure and blood sugars, you're preventing heart disease, you're preventing diabetes, and so many of the complications that come from those. And so really focusing in on and not being weary by day in and day out, treating patients for those diseases or preventing those diseases, focusing on education. But then I found too that knowing when patients need to be connected with further care. And so having that good understanding, okay, what can I take care of right now versus what needs the support of the larger hospitals or the health centers. So I've had some patients maybe that they have evidence of, already have evidence of some heart disease, and maybe they do need some more treatment. That's a great example of, there's things you can do right now, such as getting them on aspirin and cholesterol medicine and making sure their blood pressure is controlled, but they may need to see that cardiologist. So having that good understanding of when they need to go see that heart doctor, I think can be helpful. But it's often hard as a primary care doctor because sometimes hard to see the effect of what you're doing because you're focused so much on preventing further disease.
Making it, trying to put a stop to a leaking tap, maybe something like that, right?
That too. But I think every time you can keep someone in a good range for their pressures, their sugars, their exercise, their diet, then that's a win and something to be encouraged by.
So there is something someone can do, whatever the case may be. That's very encouraging to know. There tends to be sometimes an attitude by patients to want to self-medicate. You know, I got a headache, so let me just pop some pain medicine and not see the doctor. Sure. What would you say is the danger of behaving that way? Sure.
Yeah, so we have plenty of that in America as well, in patients that will even find prescription medicine somehow and start taking it. There can be some dangers. If you think about even some medicines that you can get over the counter, such as Panadol or paracetamol, ibuprofen or Brufen, those medicines can sometimes, when taken in too high of quantities, can have bad effects on the liver or the kidneys. So too much paracetamol can have effects on the liver. And too much of the ibuprofen can have effects on the kidneys. Or diclofenac, that's another one. And so if you're not taking it in the amount recommended by the doctor or provider, then that can cause some long-term effects down the road. So not that necessarily every time you have an ache and pain you need to see the doctor, but it's generally good to make sure your doctor is aware of how you treat your pain and to make sure there's not something bigger going on. Maybe someone is having some intense pain in their stomach, and so they just keep taking ibuprofen. And really, the problem is it's an ulcer that gets worse with the ibuprofen. So I'd say patients, it's helpful to think through, okay, if I'm having to take this medicine every day, or if my pain's just not getting better, that's a great time to see the doctor.
So it's never a good idea to treat yourself. Go have yourself checked by a doctor. Very good advice. So if you look at practice of medicine and the element of faith, there are some conditions that I think a client may present with, and because of their level of faith, they may believe all I need to do is pray. What's your comment on that?
Sure. Well, I'll first acknowledge prayer is such a powerful thing, and every condition that we have should be met with prayer first and foremost, and sometimes the most powerful of any intervention.
Yeah.
I think it's also helpful to remember that God has blessed us with medicines and technology that He can use to help people and alleviate their pain and alleviate their symptoms.
Yeah.
And so there are some things that are very treatable. For instance, there's breast cancer. If someone were to have a breast cancer and it's caught early on, then a surgery, and a relatively simple surgery, can take that cancer out, and they can be cured of cancer through that surgery. And if someone takes the approach of, I'm only going to pray the cancer away, maybe God can choose to take it away in that way, but maybe the way He chooses to take it away is through the surgery. And He's providing that way for the cancer to be cured. And so I still think prayer is the most important thing we do when we have medical problems, but to recognize that God can use medicine as the answer to prayer.
Yeah. So at the moment, we have a unique kind of situation prevailing in our own country, where on one hand, we have quite a number of children that do not have access to sufficient nutrition. So they will grow for the first 2 to 3 or even up to 5 years of their life being malnourished. Then on the other extreme end, we have a lot of people who are, particularly young people and women, who are overweight. So they are beyond their required weight for their age and height. What would you say would be a solution to a challenge of that nature? Where do medical practitioners begin to be the advisors for situations like that?
That is such a challenge, and to say that there's an easy answer to that would be a lie. But I think about with some of that problem, even sometimes in America, people that have little access to good food can encounter too. Sometimes the food that's available to people doesn't nourish them well, but as people grow older and they are exposed to those foods more, it can actually be very high on calories, but very low in the nutrition that they need. And so we think particularly about those ultra-processed foods, things that are very high in calories, but they have few vitamins or minerals that we're needing on a daily basis. I think back to the closer we can get back to whole foods, so whole fruits, whole vegetables, and grains, the better nutrition we're going to get, and less chance of those vitamin deficiencies. And so what I always tell my patients is, if you can get full on fruits and vegetables, then you're going to get what you need, and especially with children. And so that's where the challenge comes in. If you don't have access to those whole fruits and vegetables, what are your options? And if there's ways to get access to that versus buying some sort of ultra-processed food, anything packaged, the choice is always going to be those fruits and vegetables. But that's the challenge, especially in America too. I'll have patients tell me it's cheaper for me to get McDonald's or any of those fast foods, or KFC. We have both here in Zambia. Cheaper to get that than it is for me to shop at the grocery store. And so in America, there are some different programs that allows people to buy those fruits and vegetables at a reduced cost, or even encourage them to try to grow some of their own fruits and vegetables. So that way they can have that good access to food despite the increased cost. But I don't want to oversimplify it. It is a challenge that sometimes that can be the more expensive option.
It's very real, and it's good to know that we're not the only ones struggling. It's a common condition for all of us to kind of like navigate. I would like to ask, how do you strike a balance? Because I can imagine, first of all, the profession in itself is quite involving in terms of what you get to learn the investment of time.
Sure.
And then now when you are in the practice, I believe the hours can also be something that can have a weight on you.
Sure.
How do you strike a balance in terms of being able to be available for your family and making sure you're in good health?
Right.
Because we wouldn't want the doctor to be the one who's not too well. So how do you strike a balance in your own life? Yeah.
If you have a good answer to that, let me know. I'm still learning.
Yeah.
I'd say I'm about 3 years into my own practice, and so it's still been a journey. But I think part of it is right now I have my wife and I, we have 3 children that are under the age of 8, and so just from the moment I walk in, the demands on both of us prevent me from working on anything from work. And so sometimes that kind of just forces me, like right now I'm dad, I'm not a doctor. And so that helps to just have that complete separation. But I think learning to think through when I am at work, okay, what things need more of my attention later versus what can I address right now. That's what I've been trying to work on more recently is focus when I'm at work, being really focused on, okay, what can I get done right now for this patient versus putting it off until later. And then when I get home, when making sure to prioritize that family time. I think from 17:30 to 19:30 in the evenings, like that's time that's only for the family, and really focused in on that. And so that helps me kind of reset and have that balance. And sometimes that means at work I have to sacrifice a little bit, so I may not get all my documentation done as fast as I want to, or I may not be able to accomplish all the tasks that I want to at work. But sacrificing some of that doesn't affect the patient's health, I think is important for me to recognize.
And how is faith and your personal relationship with the Lord influenced the way that you work and the way that you raise your family and the way you interact with your community?
First and foremost, it's the foundation and structure behind everything I do, and the reason I'm in medicine, and the reason we have kids, and the reason that my wife and I got married. It's all for the glory of God. And so having that foundation is the most important. But I think about, in my clinic, it's been so great because we are a faith-based clinic. We're a Christian-based clinic, which means that it's encouraged to be able to pray with patients and to share encouraging scriptures with them. And it's such a great environment to practice in. That yes, we're here to provide medical care, but want to provide that spiritual support as well. And so it helps it stay fresh on my mind throughout the day. And then just going back home, that we can have, my wife and I can be united in that we want to point our boys to Christ. And so having just little things remind us of that all day can be helpful. So we have learned little habits, such as even when we light candles to say Jesus is the light. We have a little family worship time each night. It only lasts about 7 minutes. That's as long as our boys can stay still for, and usually not even that long. But just to have those little reminders throughout the day and the time we're with them helps us refocus our eyes on Christ, and then allowing Him to work through us.
Wow. Would you ever consider encouraging any of your boys to become a doctor, or are you going to leave the choice to them?
Yeah, I would say it would be great to see where their interests are. I think what my biggest hope for the boys is that they find the gifts that God's given them, and that they do it as if working for Him and not for men. And so if that means that they're artists, or where they work in driving cars or buses, if they can do that to the best of their ability for the glory of God, like that's my biggest hope. It sure would be cool to be able to practice medicine alongside them someday, but I think my greatest joy would be to see them doing something God's gifted them to do, and to doing it well.
Wow. And the next question I'd like to ask is, everybody, when they're maybe in their younger years, look at becoming a doctor as something that they should aspire for, just for the sake of it, because you know you've got pressure from your parents, and you know, they have all these dreams and hopes for you. Is that the best vantage point from which to approach the career, or do you need it to be a calling? What's your view?
Yeah, I would say that you'll probably be burned out pretty quickly if you're going into it for the wrong reasons or wrong motives. I would say doctors do hold a high regard in society, but if you're doing it so that you're regarded highly in society, I think you'll find quickly that you'll run out of steam, especially when you're in there with one patient and seeing patient after patient after patient, and that patient's in pain and hurting and maybe not appreciative of the care you're trying to provide. You're not going to feel very highly regarded. And so if that's your motivation, then you'll quickly be disillusioned and with medicine in general. But yeah, as a calling, if you think, I want to help people and to help alleviate pain and suffering when I can, to support patients and be there with them when I can't provide that, that can help you. When that patient's in the middle of suffering, you can know, okay, I'm not called to fix this. I'm not called for them to thank me for being amazing. I'm called to be here with them and love on them and find out ways I can support them. But yeah, sometimes it means that patient thinks that you're not helpful, but can you in that moment still provide the care that they need and to still be kind and loving? And it's that calling that keeps you able to.
That is a very truthful answer, because I can imagine in your day-to-day experience of patients, you might come across those who are in denial because perhaps you've given them the news they didn't want to hear, and that can create tension and perhaps resentment, or seem to think you're the reason why I'm in this situation. How do you handle that kind of scenario when a patient is maybe even thankless, verbally thankless or abusive? How do you cope with something like that?
Yeah, I think I learned a lot through my training that the most important thing is listening and being very slow to argue back. Because sometimes patients are not necessarily meaning everything they're saying when they're very upset with you about something, but they may just have a lot of pain, the words they're saying is coming from a place of large pain, and so respected. That means so much more. And so that's what I try to focus on. It's easy sometimes when a patient is saying something that I think is blatantly untrue. It's easy for me to want to just right away say like, well, actually this is how it works. But I think even in those moments, just listening, not denying, and then sometimes acknowledging those feelings while trying to redirect them to the underlying medical problem can be helpful too. But I think the most important thing is that they know that they're heard.
And in your experience of missions, how can the experience be more meaningful and have longer lasting kind of results? What would a mission team need to bear in mind as they're getting ready? If you were planning a mission trip for someone, what's the advice you'd give them?
Sure. Again, still very much learning, and especially there's so many different models of missions and short term and long term. But I would say for this type of trip we're on, a shorter term trip, probably the first two important things is that we come in with humility and come in not thinking that we're going to fix everything. There's so many things that we, in so many cultural aspects and dietary aspects, so many things that we know so little about. And for us to come in and think that we have all the answers for the patients and all their problems is very misguided, and I think could even cause a lot of harm. So I think one big piece of advice is come in humbly and ready to learn. And to really lean in on in our case, this church and their experiences, to show like, hey, here's where the patient is struggling, here's the challenge with the diet that you're recommending. And so really coming in ready to learn about the culture and the group and community. And I think also not thinking, even if you do know the right thing to do, not coming in and saying, this is exactly what you need to be doing. And so even when I think about the blood pressure, I had several patients this week that had pretty high blood pressure. And I can get them medicines, but I can't guarantee that they'll have access to those a month from now, right? And so one, acknowledging that, and two, talking about that with the patients, and not leaving them high and dry and saying nothing about it, but to say, you're going to run out of these medicines in 30 days, so really let's make a plan. What do we want to do when you're getting close to running out? What clinic can you go to? Who can you talk with? And so being really focused on what happens after we leave. And sometimes that makes education the most important aspect. If patients have high blood sugars and they're drinking a lot of sweet drinks, that's going to have a bigger impact, if you educate them on that, have a bigger impact than any medicine you give them for 30 days. And so focus on what's the long-term goal with this. But I think still I just come back to not thinking that you have all the answers is probably the number one thing to think about.
It's been a great pleasure speaking to you.
Thank you.
I've learned so much just about life and faith and your walk in not only your profession but your family. And if you have a word of encouragement that you'd like to say to someone who might be in pain, who might be at their lowest, what would you say to them?
I've certainly encountered several patients this week that were in pain and at really low points. And we'd always go to prayer at the end of the visits. And so praying that they would know that God is walking with them, that He's the God who hears us, and that if we're clinging to Him, one day, if maybe pain won't be alleviated in this life, but He calls us to persevere, to trust in Him, and then one day we'll have new bodies, and there will be no more sickness, death, or dying, or tears, and to hold on to that hope.
Thank you so much. I wouldn't have put it any better myself. It's been a pleasure speaking to you. Thank you for coming. It's a great gift. We need you to know that. Thank you for giving your time, because I think that's the greatest gift that you can give. And the viewers out there who have been listening into our conversation, I'm sure have walked away with a blessing in terms of how to take care of themselves. It's much cheaper to prevent yourself from being ill. So until we meet again on Community Health, this has been Jacqueline with Dr. Trey Bowen, all the way from the US. Have yourself an awesome, awesome time.